If you look at in a current scenario, a 44-year-old gentleman with diabetes and has a GFR of 86, this is say 10 years back, what is his long-term prognosis? Next slide, please. So the current understanding, his rate of GFR will fall at about 10-12 ml per year, and he'll land up on dialysis in about 8 to 10 years. Next slide, please. Now, if you want to do something, we do know that these patients will put them on the low protein diet. Next. Now, despite that, the patients will land up losing some amount of GFR. Next. And during the, we do have the keto analogs, which we add along with the low protein diet to prevent hypoproteinemia and related issues. Next. But again, the GFR will still not slow down further. Next. Now, in the more recent, we know since the decade of 90 to 2000, RAS blockade, control of hypertension and blood pressure targets have been well set. Next. Despite all this, next slide, please. I will skip these in view of time. Strong control of blood sugars and blood pressures will remain the cornerstone. Next. Now, if you were to further look at it in the current scenario, among the drugs that we have, one of the options that we have are the pre-probiotics. Next slide, please. So the next slide, please. So we do know that there is a large population of CKD patients, as we have seen with all the studies that have been, we know very well. Next slide, please. Malnutrition associated with low protein diet itself can be a cardiovascular risk, and that needs to be prevented for. Now, one of the recent thinking that has come up is the gut bacteria and endotoxins that have been detected in the serum of CKD and dialysis patients, and these lead to breakdown of the gut and lead to inflammatory state within the body, and this leads to worsening of the CKD, and that is progression of the chronic kidney disease. Next. There have been studies that are now about 5 to 10 years old and have starting with small numbers, which have tried to control this endotoxemia, and this itself becomes this becomes a target wherein the inflammation goes down, and that leads to slowing down of the CKD. Next. Among this, what has been noted is the colonic microbacteria, and therefore the pre-probiotics have come into play, wherein they kind of stabilize the colonic bacteria, the colonic membranes, and prevent the endotoxins from entering the body, reducing the endotoxemia as well as the pro-inflammatory state caused by it. Next. Now, among the ones that have been the further downstream event is that it reduces the cytokines which are known to cause the inflammation and therefore worsening the CKD at the lab, directly affecting the kidneys. Next. Once you have an enhanced gut barrier, these pre-probiotics are going to reduce the overgrowth of bacteria and therefore reducing the inflammatory process that occurs downstream. And this is how the uremic toxins, which are known to cause uremia subsequent to its collection in the body, even those side effects can be reduced by controlling the gut bacteria induced pro-inflammatory state. Among the ones, next slide, please. So these are the uremic toxins which are responsible for creating the uremic state leading to malnutrition, nausea, and other symptoms that are associated with chronic worsening of chronic kidney disease. And the pre-probiotics will land up reducing this, along with reducing the fibrosis and TGF-beta direct action and leading to that. Next. So this group of drugs, I think I'm going to skip these slides in view of time because I've already overshot. But the fact remains that the cost of these bacteria, these pre-probiotics, remains extremely high. But as is seen with any new group of drugs introduced, the cost remains high. And as the usage goes further and more people use it and more companies land up producing it, the cost effectiveness, the cost comes down, and therefore the benefit ratios start showing better signs. But currently, when you talk about the CKD cost of dialysis, which would be anywhere around 50,000 in a big city per month, postponing dialysis by a couple of years also, if possible, with all the things that I've talked about, will lead to overall cost effectiveness, which these drugs currently are under the scanner for. I think with that, I will, we can open it up for discussion because in the want of time. I'm sorry about the delayed entry because of the internet issues.